I'm Tom Hoppy, and I'm your host of the Most Painful Podcast. Chronic pain can have a debilitating impact on a person's quality of life. Where does someone turn for treatment and services to help with their chronic pain? Today, we're going to talk about interdisciplinary pain clinics. Joining me today are two experts in the field, Dr. Ramesh Zacharias, who is the medical director of the DeGroote Pain Clinic in Hamilton, Ontario. Welcome to the show.
Thank you, Tom. Thanks for inviting me.
And my second guest is Dr. Brenda Lau, who is the medical director of Change Pain in Vancouver, BC. Welcome to the show, Brenda.
Thank you so much, Tom. Looking forward to the discussion.
When we talk about chronic pain and services that are available, Ramesh, what is really considered chronic pain, and where does a person's journey start before they even get into a pain clinic to see someone like yourself?
Tom, I think chronic pain, if you look at the definition of it, it's pain that has persisted for usually more than 90 days or 3 months. But unfortunately, that definition is not fully accurate in all situations. Chronic pain can also be, you can be considered to have chronic pain if you have a particular procedure or an injury where you would normally expect healing to be occurring early, but it doesn't. So it could be you are postoperative at even 2 to 3 weeks and your pain is excruciating, out of the norm. There's a pretty good predictability that you will develop chronic pain. So those are the two criteria. It's you've had it for long enough or your healing is not occurring as what would be expected. The sad part about chronic pain is it's never a single problem. People with chronic pain also have issues with sleep and mood. And so when you have those three issues, the best treatment for it is to address not just the pain, but the sleep as well as the mood. And over the years, they found out that the best treatment is through an interdisciplinary model that focuses on those three areas.
Thank you. Interdisciplinary model is more than me just seeing the chiropractor or the physiotherapist. So, Brenda, can you kind of give us an insight to what an interdisciplinary clinic would do for someone who presents themselves with chronic pain at your door?
Yeah, absolutely, Tom. Many times we know, as Dr. Zacharias has mentioned, pain has so many facets at the nerve health, mental health, movement health, nutrition health, and even psychology. And so it's not just the pain itself. And so typically medical doctors are involved with the care, but we have movement specialists like physio or chiropractors, massage for deep tissue. You have, for example, psychology at the mental health piece, or counseling, even trauma-informed care. They could be a mix of different number of these individuals. Interdisciplinary care, the most ideal form is that all of those individuals are really working together to really understand the different parts that are making up not just the pain, but the pain-related impacts on someone's life. And their communications are really closely knit so that it really isn't just a fragmented kind of conversation, but more building on each other's work.
So if we have, say, a veteran that's coming, we know veterans suffer from chronic pain at a higher rate than the civilian population. And both of you have worked with veterans. So if a veteran's coming to a pain clinic with chronic pain and they're struggling with both physical and psychological, what would be the approach? And what's different with veterans than with a civilian patient that you may see? And I'm going to open the floor to either one of you to answer that or both of you to answer that, because I'd like to hear both your experiences.
Well, I can start first there, Tom. I know that in our system, it really kind of depends on what access to services that a veteran has that does govern some of their experience. But irrespective of what services they have, in other words, under the provincially cared services or funded services versus those who are given benefits through a Blue Cross and other kinds of insurers, irrespective of what services, the experience is different than the average civilian because of the transition. So military personnel have obviously a culture in which has governed the way they've worked and lived for whatever period of time that they have done their service in. But leaving that service isn't just hanging up the hat, isn't just stopping work. All of that culture comes with them, meaning that it really does color the way they may see certain ways in the world, but also how they react. And so, for example, if someone has had a lot of impact on their bodies and maybe traumatic experiences are now really quite heavy in relation to mental health, then you can't just treat a pain area with a procedure.
Yeah, Ramesh?
To answer the question about how do people access care, in the clinic that I work in, it starts with a referral, and the assessment involves three different disciplines. We usually have an occupational therapist, a psychologist, and myself. And part of the assessment is to do a holistic review of how the veteran is functioning on a day-to-day basis, what is the history of their injury, what have they had, what treatments have they had, and how much of a problem are they having with mood as well as sleep. And if at the end of the assessment it is felt that the veteran really would like to get treatment, we then have to decide as to whether they frankly are ready for the treatment. The biggest challenge, a barrier to entry into a pain program, is if the patient or the veteran is suffering from an issue of addiction. You cannot treat the pain if you don't treat the addiction first. So it's sort of a organized process of getting a holistic approach and understanding of the veteran. Make sure that there are no barriers for care, and then bringing them into the program. So those are the steps that we usually take in our clinic.
And what do you notice when you're bringing veterans in? And because you have a pain program at the DeGroote, which I understand is a mix of veterans and civilians when they go through that program. Are there any differences that you're noticing between the veterans and the civilians when they're going through that program?
So one of our researchers and psychologists has published on it, and we've been treating civilians and veterans now for over 30 years, and both categories do well in an interdisciplinary pain program. Our best success is with veterans, and I've often said that to veterans. Part of it is their DNA, their culture, their background, where it's service before self, and then unfortunately that results in an injury. But that same DNA of being resilient and working hard to accomplish the mission in this particular case, the mission is improving their pain and their overall well-being. They seem to be more committed and have better success. And we publish that material in a variety of journals. But civilians also do well. We have found the veterans actually do slightly better.
So what I'm hearing from the both of you is that this is different than just going to a rehab clinic for physio or chiro or kinesiology. This is more involved looking at, as you said, Ramesh, the holistic approach of a person. When you have veterans in a clinic, Brenda, the clinicians themselves, is there a different approach that they have to take towards the veteran to maybe, because there is a cultural aspect there. So is there a different approach that needs to be taken, or is it just the same process as you would with a civilian patient?
To circle back on that, Tom, I think there is the general approach from a pain perspective, which is the average medical history standard offering of therapies. All of that's the same because the human body is the human body. But we have to really take a greater sensitivity in terms of, as mentioned before, was a veteran's transition state. And what we mean by that is really how integrated they've been in the civilian world. But second is also the care and support that they've received so far in integrating back from a mental health perspective and physical perspective. Often one's military culture has a certain way of interacting with everything from schedules to noise triggers to light sensitivities to even words that can be triggering. And I think those are areas in which we just want to pay a lot more attention to. And then finally, of course, is that a lot of veterans, because they have in fact been conditioned to really push through pain, push through injuries, sometimes they don't even give themselves permissions to be healed. And so it's understanding all of that, that allows now a relationship and a trust to be built. And that can sometimes take a lot more time than even our civilian patients.
Right. And I think education seems to be key, because I think back to my own journey, I didn't even know what an interdisciplinary pain clinic was. And, I've been doing the traditional physio and the chiro, and that's, you just live on and you push on. That's what the thinking is. So it's good to have this, I think, process, but how do we educate our veterans to let them know that it's available, and to also let them know that it can be helpful, I think is kind of the key, because I think if many veterans are not aware of it, then how do we even get them into the door because I know I was kicking and screaming not to go into the door, because I thought it was all about opioids and injections. I had no concept of what the clinic does for chronic pain.
Tom, I can make a comment to you of one of the veterans that we recently had in the program who finished our 5-week program. And he commented on over the years he had a variety of treatments. He had both physical therapy with a chiropractor as well as a physiotherapist. They had got some counseling from a psychologist. They had a primary care provider. They went to a clinic that did injections for them. But his comment was they were located in 4 different facilities. And he would have 1 week he might see the chiropractor, and the following week see the physio, and then every 3 weeks he would see the psychologist, and then he would see the pain physician maybe every 2 to 4 weeks. And the difference he noticed was that when he was in our program, he got all those 4 modalities in one facility over a 4-week period. And so the communication between the various health professionals was focused in one record, in one building with this individual. And I think that's been what the evidence has shown, going back almost 10 years now, with the IASP that reviewed 45 countries who had this multi-location, multidisciplinary model as opposed to one facility, similar to Change Pain in BC, as well ourselves, and a variety of clinics in Canada. The results, frankly, work better. That's part of the reason why they use the same model for cancer treatment, by creating a group of specialists at a cancer treatment center with the oncologist, the radiation oncologist, as well as the ones giving chemotherapy, palliative care doctors. So it's a one-stop treatment where you can bring all these disciplines together. And it was quite interesting that the veteran at the end of the program said, I'd been through a lot of these in different locations. And now that I got it in one, I feel I was able to consolidate my benefits better.
I want to build on Dr. Zacharias' comments there. I can't support that more in our observations as well. And what makes it really challenging when I was previously trying to talk about entry into and access into services, not every clinic has this ability to actually do a program approach, yet we really need the multidisciplinary, the interconnected approach, irrespective of what the sources are. And so the concept of having people under one roof is key. Second is that the communication between the members are key. But the third is, in particular, then it really helps people feel a sense of cohesion, and that when a recommendation made from one discipline, it actually complements the other, rather than, again, separate parts just being addressing at separate kind of time and locations. I think that adds to that sense of fragmentation, but also confusion, which already veterans are already facing in their lives, just trying to resettle in. So thank you for that comment, Dr. Zacharias.
And I think it's not just veterans, probably anybody who goes through a clinic would benefit from having everything under one roof. We talk about a pain program that lasts for 5 weeks, but is there, with chronic pain, I mean, it's life lasting. So is there further follow-up? There's another pain program that they go through? Like, how does that work within an interdisciplinary pain clinic? Or is it you just go to this clinic for a certain amount of time and then you're back out to your own other care providers on the, like physio or chiro or something like that? Brenda?
On our part, we have a mix of structured programs in which they're time-based, anywhere from 4 weeks to about 3 months. But really, we know there's a before and after, not only even in preparation for the program, but also afterwards. A lot of times people take time to consolidate skills, their networks. They now have gained trust and supports. And for them to make those next steps, changes in their lives, they also need people to continue to support them. And usually not a new set of people, but the same people that you've reestablished that trust with. And I think in particular for veterans who are in the midst of their transition, that trust factor is going to be a huge part of their healing. So I think if there's a mixture of program, but also maybe provincially supported services that are ongoing and not necessarily limited just to program length, those things can be helpful. So benefits are for ongoing support are very variable depending on a veteran. And some might just need the medical piece. Others might need a little bit more of the multidisciplinary. And so if there are options that especially are covered under the provincial health plan or the Blue Cross benefits or any of their insured benefits, that can be helpful because integration of those changes take variable time for different people. And that's why I really like so much the Chronic Pain Center of Excellence effort that's happening, because at the national level, at even a web space level, there is this common thread for every veteran in every province so that they know that there is a resource that they can lean on, not just their local provider.
Tom, to address your particular question, when we do the assessment, it's disappointing for patients who are referred to us, but we stress to them that we will not take their pain away. It's impossible for us to get rid of their pain. Our focus is on improving their overall function, and that throughout the program, we teach them a variety of tools so that when they're having a good day, they know what to do. And when they're having a bad day, we teach them strategies such as pacing, breathing, relaxation. Part of our program includes yoga, Tai Chi. We do medication management. So all we tell them is every day, learn a new tool that's going to help you when you leave the program. And they get binders. They're taught to use stickers and reminders around their house to have they done their exercise today? Have they taken their 10 minutes to do their relaxation? Because these are just tools that we're teaching them. We will not take the pain away, but we will certainly help them improve their overall function. And so we try to follow them up at 6 weeks, 6 months, and a year. But if there is a gap in our program, even today, the follow-up needs to be better. But part of the improvement could occur is if we're able to educate their healthcare providers who are not part of our clinic. And so these education programs that we do, including things like the podcast, are ways to get the message out. Because I always tell the patients, it's like a train track. We're just switching your track and starting you on a new track. But all the tools are what you're going to use as you take your train down this new track. That's all we're doing is adjusting what has been the norm for you to now become the new norm in your overall function.
So what I'm hearing from the both of you and for the people that are listening is that it's a holistic approach, that people are learning new tools to manage their pain to improve their quality of life, and something hopefully that they can take with them as they continue to move down the road of recovery. But I think with the veterans too, there's that added piece of culture and identity that they also struggle with in their transition coming in or leaving the service, I should say. So we have a few minutes left. I don't know if there's any last comments from Ramesh or Brenda would like to finish off our podcast.
I think I just want to reemphasize how much that, people's efforts have been put in to create resources and for people not to feel overwhelmed by now the breadth of them that's available either per province or at the national level. I think just like Dr. Zacharias is mentioning, it's building on those resources, those skills, and not to feel overwhelmed, but rather a sense of hope. We now know that there are really good teams teams across Canada that have not only experience but the desire and the team infrastructure ready and supportive. And now knowing that, it isn't just one technique. It's being open, being curious, to knowing that these interdisciplinary teams have a number of different supports that could maybe speak better to them at this time as compared to 6 months from now or a year from now. And things will change. And these teams are able to shift with the veterans as they change as well.
I think that really sums it up quite well. I'll leave it to Ramesh if you have any last words, Ramesh.
I think you've heard a lot, and when I do see veterans, and about 60% of my practice is treating veterans. Culture is a huge part of their DNA. And I tell them, take advantage of the culture you actually have, because that discipline, the commitment to meeting goals will be helpful for you in your journey. And it is a journey. It's not a destination. It's a continuous journey that veterans will sadly have throughout their lives as they deal with pain, sleep issues, as well as mood. But the message I really want to give them is that there is hope for them. The research is now better than it always has been, than it ever has been. That these techniques and these opportunities and the various modalities and medications and options that exist, you have a better chance of a better quality of life today than you did even 30 years ago if you suffer from chronic pain.
Well, thank you for that. And I agree. I think it is a journey. And living with military culture is just learning to manage it. And like you said, Dr. Zacharias is using the good things we learned with our culture to help us on our journey. Well, I'd like to thank the both of you for attending the Most Painful podcast and for your insight. I know we could probably talk longer about this subject, and I know it'll be helpful for many veterans and anybody who's suffering with chronic pain. So I'd like to thank you for coming on the show.
Thank you so much, Tom. It was an excellent discussion.
Tom, thank you very much. It's my privilege to be part of this podcast.
The Most Painful Podcast is produced for the Chronic Pain Center of Excellence by Story Studio Network and Eye Contact Productions.